Now this is an ultrasound study of a 40-year-old male. Came with a history of dysuria and painful micturition for the last few weeks, and this is what his ultrasound is showing us. This is the right kidney, the outer surface, the parenchyma. Now these are the dipping signs of hydronephrosis, dilated calyces. This is the dilated pelvis, and PU is the proximal ureter. Now the proximal ureter measures 16.4 millimeters, and normal should not increase more than 7 millimeters. This is the distal ureter in longitudinal section, and it measures 8.1. And if you see that in this tubular structure, the distal ureter, we see a dense coarse echogenic area measuring 10.9 millimeter, which is a calculus impacted in the most distal region of the right distal ureter, and this is the shadow. This black area is the shadow from this calculus. This is the longitudinal section of the urinary bladder. The bladder walls are normal. There is no evidence of cystitis, no stone within the urinary bladder. This is the prostate. Periprostatic fat is intact, and the prostatic dimension is within normal. So the cause of dysuria in this gentleman is a calculus impacted in the distal ureter, because of which we see hydroureter, and this hydroureter is leading to moderate degree of hydronephrosis, which preserves the parenchymal thickness. You see that the parenchyma measures 12.1, and the mid-anterior region, which is acceptable, and at the upper pole 20 millimeters fine enough. Now let's see on real time. This is the patient being in left atrial decubitus posture, and you can see that this is the kidney, right kidney, showing us now. This is the parenchyma capsule. These are the dilated calyces. The upper pole calyces, mid pole, lower pole calyces, preserved parenchyma, intact corticomedullary distinction. This is the upper pole parenchymal thickness in real 17 millimeters, and here we do see the dilation of the proximal ureter. एक लंबा सा रखे सर को साकिचो तरoko. Here, this is the proximal soluble. Now, this is the capsule, this is the lower pole, and these are the dilated calyces due to moderate degree of hydronephrosis, the middle region calyces. This is the pelvis of the kidney. This region is the pelvis of the kidney. And from here, a tubular structure you are seeing is the proximal ureter. So we see dilated proximal ureter, measuring 16.4, and normally it should not exceed more than 7 millimeters. This is the right kidney being exposed from the prone posture, and in this case the kidney measures 12.0 centimeters in length. 11 is the normal limit, and 5.6 centimeters in anterior posterior diameter, which is both are enlarged, so kidney is enlarged. This is the prone section of the left kidney, and you can say that this kidney is within normal size dimensions, measures 9.2 centimeters in length and 4.3 centimeters in anterior posterior diameter, with a calculus with posterior shadowing. This is the shadow from the calculus situation. So the right kidney, now when we come to in the pelvic region of this 40 years old male, we see urinary bladder is showing normality. However, you see a tubular structure. This is a tubular structure adjacent to the right posterior wall of the urinary bladder in transfer section. And don't confuse this with the seminal vesicle. This is not the location of the seminal vesicle, number one. And number two, this is the seminal vesicle in transfer section. Now when I rotate the probe 90 degrees, I get the dilated protein, the right distal ureter, with this being the calculus giving posterior shadow. So this is the distal ureter, this is the calculus giving posterior shadow, and this is the prostate in transverse section. This is the urinary bladder in longitudinal section. So this is the prostate in longitudinal section, and this is the prostate in longitudinal section. This is the transverse section of the prostate, and this is the longitudinal section of the prostate. This is the prostate, and this is the prostate. Let's see the left kidney. There is a calculus seen at the lower pole of the left kidney with no evidence of hydronephrosis. This is the calculus. Why this is the calculus? It is giving posterior shadow. This measures approximately 10.2 millimeters. This is the transverse section of the kidney and left kidney, and here is the calculus. Again, you can see. So this is our study. Thank you.